a family health nurse, its responsibility is to do what? Is to care, is to manage, is to plan for the family. Is responsible for the health of the family. Now, this family can be an individual in the family. Individual what? Member of the family or of a family. And can also be members of the family. You know what that means, right? This one can be individual. Maybe the father in the family, mother in the family, children in the family. Members of the family can be uncles, auntie, like we said earlier. Okay, that is what they are. So now this family head holds this responsibility to care for these people. So let's go ahead to talk about the community health nurse. So talking about the community health nurse, this community health nurse, what do? They make plan. I hope you guys can see the board clearly. All right. So a community health nurse holds the responsibility of making plans. Plans for what? Plans for all the components. All the components of what? Components of what? The health, community health for the community. I hope you understand what that thing means. They say a community health nurse, its responsibility is to do a plan for all the components of the community health for the community. What are the keywords here? Plan. Plans for all the components, you understand, of the community health for the community. See, this community health nurse make sure that the community are getting all the components that will keep them healthy, all the things that will make them to feel better. Okay, so the community health nurse will plan for all the components, all the things that will make the community stay healthy, all the things that will bring about healthy living for the community. So that is the responsibility of a community health nurse. And these components includes the following. Let's mention them. One, we have what? Sanitation. How can this be possible? We know what sanitation is all about. All right. So now in the layman, sanitation is what? Making sure that the place is what? Hygiene. Making sure that refuges, sewages are being removed, sanitary water are being removed from the environment, from the community, to do what? To reduce what? To reduce spread of what? Microorganisms, and also to reduce diseases, coming into or affecting human in the environment or in the community. Now, this sanitation actually, how is it going to be possible? The community head will come to which the responsibilities for the community. We come to the community. When he or she comes to the community, what he or she will do, he or she will go to the what? The community chiefs, the royal highness, the higher hierarchy in the community, and they will do what? Educate, pass this information to them, give them the reason why they need to announce for sanitation. In some places you'll be hearing them, they call town criers, they call some meetings, they call the village, they call the community for a meeting because they want to do sanitation, right? They want to actually keep the environment clean. Now, the point is that this community health nurse will give that information, or provide information, the reason why the sanitation is important, for the community. Now what happened is that the chief will organize this meeting, call the his cabinet, and they are going to organize this meeting, and the information will be passed to the people. You see that everything will be fine. So that is the responsibility of the community health nurse, making sure that the environment is clean, because the purpose of this environment being clean will help to reduce mortality rate in the community. Of course, because when there is stagnated water in a place, there's no sanitation being observed in that community, what happens is that stagnated water will breed microorganisms to breed, for example, mosquito. Now you remember that the malaria we suffer today, or malaria parasite which we actually suffer today, is because of what? Mostly are caused by nearby gutters or water channels that have been stagnated and not being cleared up. Now what happens is that this mosquito, they breed inside and they start developing and maturing, and start releasing to the environment. And now this female anopheles mosquito, which carries the plasmodium, will come to human body and infect the human body with that plasmodium, which actually takes some stages now to cause us to have to develop malaria. So to prevent all those things, the community health nurse will pass this information to the community. So the next thing we should talk about is immunization. That's another component. You can see the reason why they say immunization. You can see this one. They said all the components of the of components of community health. Now for immunization, you know that immunization helps us to prevent communicable diseases. To prevent to prevent communicable diseases. Okay, to prevent communicable disease. Example, TB. You know what TB is all about? TB is tuberculosis. Okay, now this immunization will help to prevent communicable diseases. Now what will happen is that the community health nurse will pass this information, tell the chief that they want to go out for immunization, and the chief, of course, they will permit, and they will give the reasons why immunization is actually important. Now they're going to give the reason to the chiefs, and they will approve it. And when they approve it, immunization will be given. Okay, immunization will be given. Remember, the immunization starts from age 0. As they just give birth to that child, they're supposed to give immunization, and it ends at 5 years. All right, 5 years, 0 to 5 years for immunization. Now BCG is given at birth. Okay, it's given at birth. It's very important. Or of course, we know that BCG will do what? Will prevent this TB. Okay, that's one of the examples. We have measles, we have meningitis, we have other kind of diseases that immunization can actually help to prevent. Now, what happens is that we have clean water. The community health nurse will also provide, or will also do what? They are also making plans for clean water. They also make plans for clean water. Please let me come here and clean water. Okay, so clean water helps us. When the water is clean, it is free from microorganisms, right? Remember that most of the it's popularly known as typhoid. This salmonella typhoid that we always see when we are running when we run a typhoid a wider test, is caused by contaminated food and water. So now the community health nurse will make a plan for clean water. All right. So another thing, education. She or he will also do educate them. Education. They will make plan to educate. This education will bring about seminars, counseling. All right, counseling the people. Now, because of different things that can actually keep the community, even if it's not just illness, even emotionally down can actually cause illness to the people in the community or to anybody. So what happens is that this community health nurse will make plan also to counsel the people, to organize seminars, to organize counseling, so that the people will actually air out their mind or whatever that is bothering them. Some can be financially some can be financial issues. So as a community health nurse, you make plan for all around. They said all the components all the components, and it's very what necessary. So we have many of them. All right, I just mentioned few of them. Now we talk about even maternal and child health, even maternal and what child care. All right, they're also taking care by maternal. Let me add it here: maternal stroke what child care, like child health care. Okay, maternal stroke child health care. All right, so that is it.